Yamhill CCO has invested millions of dollars in housing projects, a couple of which haven't even started yet. It's going to take 4, 5, 6 years for those to actually come to realization. In the meantime, we have to continue to build the relationships around those projects and understand and lead the way that these projects are actually brought to service to the community.
This takes long-term partnerships, so we have to trust who our partners are. We have to have partnership with them for many years. We're really thankful to have YCCO involved in this project because we know we're going to be partners with them for a long time. So housing is healthcare. You need them both. If someone is housed, they're going to have housing, they're going to be able to manage their illness, they're going to have less hospitalizations, they're going to live a happier life, and they're going to cost the taxpayers less money as well.
For me, I've been here 23 years, so that relationship builds, and and I've known some patients who just over time that's a big question when I see them is, do you have stable housing right now? Do you have stable food source? And trying to coordinate them with even our care coordinators here to get resources to kind of help them with those items, because really, you're not gonna make any headway on any medical issue if people don't have some food and they also don't have a stable place. For some people, it takes years to develop that trust that we're kind of really working together with them. It's usually not one visit that people just are all in and trust you. It is a year's process. And so any disruption to that definitely disrupts that patient-physician relationship, but it also disrupts their overall health and well-being. And oftentimes we'll see when that's disrupted or something happens that we don't see it. Maybe they get transferred to another clinic unintentionally, and then things start to go awry, and we try to figure out how to get them reconnected in, because it is a long-term relationship that we work on. Something we're all struggling with, and it does take a long-term investment.
And when that continuity of care is disrupted, it's almost like starting all over again. What we want to do is we want to maintain the networks we have, the partnerships that we have, and continuing to build on top of those for the overall success and health of the community. And so having a shorter term contract doesn't allow the community, the providers, the networks, or the organization to feel confident in moving forward on some things that are, actually revolutionary. And so having the confidence that we're going to be here to actually see the project through is important.
It's a long-term game. When you talk about social determinants of health, these are things that everybody deal with on a daily basis, and it's all packaged into health. And so we can't separate what you happen on social economic determinants relative to health. So they're both combined together.
And so understanding that in order to make investments in those provider networks, investments maybe in housing and other types of services across the community, we need longer term contracts to ensure that we can see these projects through. So for instance, it doesn't make sense to start a project and then for the organization to just not be there anymore.
When we're talking about population health and addressing social determinants of health in particular, those require long-term strategies, long-term partnerships in the community that's built through relationships over time with community-based organizations, with the delivery system partners, with education. And those are things that take vision, take strategizing. There needs to be a planful approach to this. These are investments that pay off over time. They're not quick returns. For example, investing in a housing strategy or supportive services for food insecurity and other types of issues like that. Those mature over years. It does require investment and partnerships between the groups within the community.
If we had to change CCOs, we've been involved with the YCCO since its inception as the providers in the community, so we've had involvement in kind of what's best for patient care. We feel really personally involved with it, and if we had to kind of change that relationship, it could really disrupt that overall care for our patients.